This is a special edition of the Mike Farwell Show. All you need to know about COVID-19 on 570 News.
And this special edition of the show comes amidst the COVID-19 global health pandemic. We are joined on this virtual town hall with me in studio at 570 News and Rogers TV. And on a video conference call, we have Patrick Gaskin, who's the president and CEO of Cambridge Memorial Hospital, Ron Gagnon, who is the president and CEO at Grand River Hospital, and Lee Fairclough, who's the president of St. Mary's General Hospital. To each of you, thank you very much for making the time to do this for our community tonight.
Thanks, Mike.
Thanks for having us.
I think the very best way to do this, given the technology, is we'll just move forward in a democratic fashion, which I think is alphabetical. So, Patrick, I'm going to start with you at Cambridge Memorial Hospital as we dive into the conversation tonight. And I think one of the biggest things on people's minds is equipment at our hospitals. Do we have what's required to treat patients? And do we have what's required to keep those treating the patients safe? Patrick, what's our situation at Cambridge Memorial?
Well, Mike, I think it's really important for people listening and watching to recognize that across the region, we have been working collaboratively around ensuring that not only do we have the supplies, the equipment, the staff, the physical capacity, really incredible amount of planning effort at the front end of this. And this is, a Herculean effort in terms of what all the hospitals are doing to mobilize the resources to be able to make this, to be able to handle the pandemic effectively. And, a shout out to the staff here, the staff across all the hospitals and all the sectors in terms of making sure we're mobilized and ready to act.
Do we have enough by way of ventilators, personal protective equipment for frontline medical personnel?
I know that each of the hospitals have put in additional ventilators. We've had 2 additional ones arrive since we put in an order for that. Can't speak to what the other hospitals have done. We've looked at the equipment that we have in terms of mobilizing other equipment in terms of whether it's an operating room gas machine and how we could manage to use that in the situation. So, absolutely in terms of looking at our current supply, what we have in a regional stockpile in terms of ventilators for distribution for that. And what we do is we're doing that in a collaborative way for that. So it's not just looking at what does Cambridge Memorial have, what does Cambridge have, what does St. Mary's have, what does Grand River have, in terms of making sure we're working and mobilizing to meet the overall community need.
Ron, I'll shift over to you. Are you confident that Grand River Hospital has what's required to treat patients and also protect frontline staff?
Yeah, I would echo what Patrick was just saying. We've been at this now since early January. We had a very generous donor step forward and help us all to what I would call think freely, and help our staff do the same and to begin preparing. And I think all of us, plus our respective staff, are spending time looking and learning from what's happening around the world, and trying to project forward what will our needs be. So on any given day, trying to plan for what's coming. And we know that between now and the next week or so, we will definitely have what we need to have. And the weeks after that, we're working collaboratively, and we're working with the province to make sure that we continue to have the right equipment. And I know I can speak for my colleagues. We all have as our first priority the safety of our staff and those providing care. And that's something that won't be sacrificed.
And you mentioned working with the province, Ron, in the next weeks, the weeks ahead, to have that equipment. Do we have it now? Is the frontline medical staff at Grand River Hospital fully equipped for the job at hand?
For the job that we have to do right now and up to the coming weeks, we believe that we do. We are, like every other hospital in this province, probably across the country and probably across the world, forecasting for what our needs will be and making sure we're working with the right supply chains. And I would give a shout out to our local community as well, who how they've stepped up has just been amazing and breathtaking, quite honestly. We heard the Prime Minister yesterday give a shout out to one of our local innovators, who stepped forward really early and helped us to protect our patients by putting in portable walls. And there's many, many examples of that kind of ingenuity.
Lee, I'll shift over to you at St. Mary's General Hospital and the status of equipment, both ventilators for patients and personal protective equipment for frontline staff. Are we well equipped at St. Mary's?
Yeah, I mean, I think my colleagues have said we've been thinking about this a lot for the last several months and working pretty closely together on how we might address this. One thing that we've thought a lot about, we are a regional thoracic and respiratory center, and so we anticipated that we would see quite a lot of cases early on at St. Mary's General Hospital. Ron mentioned the donor who actually supported all three hospitals and allowed us to think quickly and creatively. And, to give a specific example, it allowed us to get a unit that was dedicated for COVID set up well with the equipment that we needed quickly, and really use that time to then open up some of the capacity that Ron and others have mentioned. So I think in terms of some of the equipment, we've been as proactive as we can to try to procure that and be ready together. In terms of protecting our staff, I mean, this is probably one of the things we think about the most, is ensuring that we have the equipment to protect our staff. It's something people will have heard about, the supply chains globally and what's happening with them. China was a major producer of the protective equipment we need. They're recovering from COVID now, so things are looking more encouraging. But we have the staff, the equipment staff need when they come in to care for patients. We won't be in a situation where that's not the case, but it's something that we've had to manage very actively. And again, this is where I'd like to do a shout out to the community, because the community has stepped forward not only with big donations of personal protective equipment, but also helping us with supply chain, helping us to get into that supply chain and alternate sources where we can. So it's been fantastic to see the level of support coming from this community.
Each of you has mentioned managing what we have effectively today. What does that look like? And Lee, I'll start with you on this one. What does that look like in the hospital? Is frontline staff being rationed, for example, to one face per shift?
So the approach that we've taken, you do right now, if you do come into the hospital, in all of the clinical care areas, you will see people wearing some level of protective equipment. Again, we're guided by what we know about this disease and what we need to protect our staff, and so that people are using the appropriate level of protection that they need. We are looking at ways that we can conserve it. That does not mean going without it, ever. But one of the things that we are doing is seeing, and many hospitals is looking at how we can ensure that we get the most out of that equipment that we can. And then appropriately, of course, change that equipment as it needs to be. So I think when you hear us talking that way, it's really having our clinical teams think critically about the level of protection that they need for every clinical interaction that they have, using their clinical judgment in that situation. Our job is to ensure that PPE is readily available for them for the care that they need to provide for that patient.
Patrick, how is the personal protective equipment for staff doled out, rationed, monitored at Cambridge Memorial?
See, I echo what Lee has said in terms of the conservation strategy, Mike. And I would use the notion around rationing, because rationing, in my mind, implies that people aren't getting what they need, or they're getting less of what they need. So the model is, what do you need to do that? So we are, in terms of our conservation strategy, every clinical area has every person in that clinical area has a face mask on. And so if that becomes soiled during the shift or anything like that, they get a new one for that. But so it's that strategy of making sure, that they have what they need. We've augmented that by working with, Inksmith 3D to get face shields. So those have started, coming in, so that we're, again, another layer of protection that we're adding for that, so that at that clinical interaction, as my colleagues have said, keeping our staff safe and keeping our patients safe is first and foremost. And using known conservation strategies now is the methodology that we have in terms of implementing it that way, so that we make sure that our strategies help ensure that we've got the supply as the new supply chain comes in, as Lee's talked about, as new supplies come in, that we've made sure that the strategies that we have in place now will help us make sure that we have enough supplies until that new supply chain is fully operationalized.
You speak of those conservation strategies, Patrick. Upon what are we basing that besides the conservation of this all-important gear? And by that, I mean, what research can we look at that tells us that what we are doing for conservation is safe for the people using the equipment?
I'll speak what happens here at CMH, and I think it's probably very similar to both what my colleagues at St. Mary's and Grand River do in terms of, we have a table that involves our infectious disease specialist, involves our chief of staff, involves our infection prevention and control individuals, our occupational health and safety staff as well for that. They're looking at whether it's the national standards here, whether it's the WHO standards, the Center for Disease Control, in terms of effective strategies around PPE conservation. They're making sure in every environment, whether it's droplet precautions or aerosolized precautions, they're making sure the staff have the material that they need and are using the PPE appropriately for that. So that's, it's walking the floors, it's the daily conversations, it's the pictures we actually put out to make sure staff know and are using the appropriate PPE in each of those situations. None of us want to put our staff at risk in terms of making sure that we've got the PPE that they need for that, and making sure that we have that available to them for that. So, it's a multi-pronged approach, but it's driven clinically with the research, both kind of what we gather locally for that, but then which we're informed by whether it's provincially, nationally, or internationally to guide the decisions.
We are joined on this special COVID-19 town hall on 570 News and Rogers TV by Patrick Gaskin, the president and CEO of Cambridge Memorial Hospital, Ron Gagnon, the president and CEO of Grand River Hospital, and Lee Fairclough, who's the president at St. Mary's General Hospital. We'll take a break and come back with more with our hospital administrators. Your calls are welcome. If you have a question to be answered, they are happy to take them. Stay with us on 570 News and Rogers TV.
We know you have an opinion, so call the Mike Farwell Show, 570-2545, 1-800-570-5715, and star 570. There's always... COVID-19, we now return to this special edition of the Mike Farwell Show on 570 News.
And we are joined by the president and CEO of Grand River Hospital, Ron Gagnon, Lee Fairclough, who's the president at St. Mary's General Hospital, and Patrick Gaskin, who's the president and CEO at Cambridge Memorial Hospital. Ron, I'll come back to you on this next question, and I want to stay with personal protective equipment for a moment. We understand that there is a similar system across all three of our local hospitals, and the conservation strategies and methods that are being employed around our hospitals. What does that look like for COVID-19 testing areas? If a patient is being tested for COVID-19, is the personal protective equipment being worn by the person conducting those tests similar? Are the same strategies employed?
Yeah, like they are the same strategies. Those strategies are guided by both the directives and the guidance that we get from the Provincial Medical Officer of Health. And that's based on what's coming out of, as Patrick was saying, the World Health Organization and other research. And the people that we have working in our assessment centers are, provided with the proper personal protective equipment and are using it in the appropriate situations.
From the equipment that these frontline healthcare workers are wearing to their overall health, obviously that's what this is all about, because we need those frontline workers to remain safe and healthy so that they can take care of those of us who fall ill. Ron, when it comes to what is being done to monitor and or test frontline healthcare workers on a regular basis, what is happening at Grand River Hospital?
So like what happens at our partner hospitals, every staff member and every physician, every person who walks through our doors is screened every day. So that's one part of it. We also had processes in place when our staff or physicians traveled, and when they returned, there was a need for them, if they weren't in a critical service area, to actually stay home and for a 14-day period. And if people are exposed to COVID-19, then we also have them staying away, and we have our occupational health and safety team who follows up with them on a regular basis. So there's a number of things that we're doing to make sure that they're well, make sure that they're healthy. We have access to our employee assistance program as well, because this is a high stress, high anxiety time, trying to get people access to that. Earlier this week, the three of us actually initiated a survey of our respective staffs to understand from them what are the things that are on their mind, potentially away from work, that the community can help them out with. And that was actually an idea from people in the community who have stepped forward to say, we want to help, we want to volunteer, how can we help? So we've actually gone out to our respective staffs to ask them, what can help you?
Lee, I suspect the situation, but that everybody coming into St. Mary's General Hospital is also being monitored and testing is happening where required?
Yeah, absolutely. So very, very similarly, people, certainly our first thing is if you're experiencing any symptoms, please don't come to work. And I think many of the staff have really taken that quite seriously. The other thing is, of course, when they do come in, they are screened. And all the things that Ron mentioned. The additional one I will say is that we do prioritize testing of our healthcare workers to be sure that we can, if they are experiencing symptoms, we will test them quickly in our testing clinics and make sure that we get those results back. And so we've had a number of staff tested who have had symptoms, and I think that's just an important part of confirming, ruling out COVID-19 in many situations, and then also enabling them as soon as they're feeling well to come back to work quickly.
All right, we have Tom waiting on the line with us to ask a question. Tom, good evening. Go ahead.
Good evening. All the best to our people in the front lines, and they deserve to be protected and given everything. But all we can say that this is going to happen a week, 2 weeks. No, this is a long term, and this is the only proposition that we can get, because we don't have the equipment that they need. The a-hole prime minister.
Okay, Tom, what's your question? What's your question, please?
This is the question.
Okay.
He has to go and make a deal with China. Okay? He has, because nobody else is supplying this. They're helping Europe and everybody.
Okay,
But
Tom, what's your question?
the question is that everybody should phone him, the premiers and everybody.
Okay. Tom is upset with the Prime Minister. Patrick, I'm going to bring this over to you because the notes that I had on Tom's question is around the supply chain. If we are indeed, and we know we're getting help internationally in procuring the necessary equipment, how does that trickle down to Cambridge Memorial Hospital, St. Mary's General Hospital, and Grand River Hospital?
We've recently mobilized a sort of a provincial and then now a regional logistics framework for that. So in the past, we've all procured or we have all sourced material ourselves that we need, or we've worked through centralized buying groups that we're part of. Lee probably could speak better to it. We've got actually now implemented a sort of a provincial distribution system for some of the provincial supply that's going to come in. And maybe, Lee, if you're okay, Mike, I'd pass it over to Lee because I think she's got a good sense of kind of that's rolling out in terms of some of the regional supply chain that's being implemented now.
Certainly, please, Lee. Thank you.
Yeah, sure. I think first of all, in terms of the comments started with talking about the federal government, and I think that they have been working to ensure that we can secure access to the supplies and then collaborating closely with all of the provinces, for how those supplies can be distributed as we might need to. And then, as Patrick has said, from a provincial perspective to the regional perspective, we're really looking, we're all working pretty closely together, monitoring the situation for COVID-19 in our communities, and then being sure that we can understand what are some of the supplies that are available, making sure that across hospitals, if we ever need to help each other out and ensuring that there's supply available, we'll be able to. And that the whole distribution channel that Patrick is talking about is designed to be as efficient as we can and be sure that a lot of the protection we need is directed to the healthcare system. I just want to mention too, the weekend was a good example of that process sort of playing out, and people saw it in the news. And we also saw a lot of companies, local companies here or other companies across the province who did in fact receive some shipments of certain kinds of PPE and then immediately sort of donated it to the health system to help us through this. I think it's been it's a big effort to manage it, and as I said in my earlier remark, it's probably our top priority to be sure that we can protect our staff.
Lee Fairclough, the president at St. Mary's General Hospital, Patrick Gaskin, the president and CEO at Cambridge Memorial, and Ron Gagnon is with us as well, the president and CEO of Grand River Hospital. Obviously, COVID-19 is an issue that we are passionate about right now and concerned about right now. Halfway into the show, and only one comment about the a-hole Prime Minister. I'll take that as a sign of success so far. We'll take a break and come back with more on this special COVID-19 town hall on the Mike Farwell Show. 570 News and Rogers TV.
Compelling, noteworthy, and entertaining. The Mike Farwell Show checks all the boxes. Hang tight. More local talk coming up next on 570 News. one for news in the Waterloo region. This is 570 News.
Good evening. It's 8:30. I'm Maddie DeMart with the 570 News top story. For the second day in a row, we're learning someone with COVID-19 has died in Waterloo region. The region's acting medical officer of health made the announcement this morning. She says the man in his 50s was being treated at St. Mary's General Hospital and had a pre-existing medical condition. The number of coronavirus cases locally has risen to 117, with 14 more reported today, including residents of local long-term care homes. As a result, outbreaks have been declared at Sunnyside Home and Highview residences. Waterloo Fire Chief Richard Hepditch has confirmed to 570 News that one firefighter has tested positive for COVID-19. They were last at work last week and operate out of Fire Station Number 1 on Weber Street North. Hepditch says 8 other individuals have been impacted in some way but would not elaborate. However, he reiterated only one firefighter has tested positive for the coronavirus. Ontario is launching a $50 million fund. It's to help businesses retool their operations to produce medical equipment and personal protective gear. Premier Ford says it's one of the most ambitious efforts undertaken by the province in generations. It comes as Ontario reported 426 new cases of COVID-19 today. It's the largest increase in cases since the pandemic began. More news online at kitchenertoday.com. Maddie DeMart, 570 News.
This is a special edition of the Mike Farwell Show. All you need to know about COVID-19 on 570 News.
And to get that information, we have been granted an hour with the heads of each of our local hospitals. Ron Gagnon, who's the president and CEO at Grand River, Lee Fairclough, who's the president at St. Mary's, and Patrick Gaskin, who's the president and CEO at Cambridge Memorial. Barbara is on the line with a question. Hi, Barbara.
Hi, Mike. How are you?
Good, thank you.
Thank you so much for doing this town hall. I think it's fabulous. I have a very specific question. I noticed that in Italy and Spain, the efficacy of ventilators is very, very poor. Very high numbers of people are not coming off ventilators once they're put on. I realize we're not quite there yet in the region, but are we thinking ahead to, do we need to change protocols, or does something need to change so that we have better results from putting people on ventilators? I know New York just announced that 80% of people put on ventilators don't come back off alive. Sorry to be so specific, but are we thinking ahead to that? Let's not wait until we're looking at that situation. Do we need to change protocols or something? Thank you so much.
Thanks for the question, Barbara. Ron, I'll come to you on that one. Do we need to be considering a change to protocol when it comes to our use of ventilators and their efficacy?
Well, like I said a little bit earlier, one of the things that we're all trying to do is learn from what's happening in other parts of the world. And our clinical experts are, this is the type of discussion that they have on a regular basis. Whether it's ventilators, whether it's some other care delivery approach, that is something that that team looks at on a regular basis. So I'm confident that they're on top of those types of options.
We have talked about what we are learning from other parts of the world and how we are actively preparing here for a surge. And we even heard Premier Ford mention the possibility of that surge today, despite our best efforts when it comes to physical distancing, staying at home, et cetera. Ron, I'll begin with you on this one as well. And that is the capacity in our hospitals as it stands today. How many ICU beds do we have at Grand River Hospital, and where might we look to create more space should we need it?
So I would say that the number of ICU beds that we have is growing on a daily basis, and combined between the 3 hospitals, we've actually identified just shy of 430 more spaces that we will put into operation over the course of this. And somebody said it earlier, this is going to be a marathon. It's not a short-term type of event. And we're also working very actively with people in the community to identify spaces outside of hospital where, people that might be alternate level of care or that might actually be better cared for out in the community would be able to go. So we're talking with hoteliers, we're talking with in the worst case scenario, large facilities where we could deploy a fair amount of equipment and staff, to deal with what I'll call a super surge, as opposed to the surge that we expect to see. And I would say that some of the efforts that we've taken as a community, social distancing, some of the other measures that we've taken will have a positive impact. That's been demonstrated around the world.
Okay, let's go back to the phones. Roberta, hello, what's your question?
Yes, hello. I was wondering about all the hundreds of people who are on dialysis and they are elder and they have other health issues. How are you protecting them? And they have to go into the hospital and go in elevators, walk around parts of the hospital, and they don't have a choice. And they have to come back and forth. And if there's how the virus, is it spread airborne through ventilation systems in the hospitals?
Roberta, thank you very much for the question. Lee, I'll come to you on this one. Obviously, there's a great level of attention on COVID-19, but what about other vulnerable patients in our hospitals?
Yeah, I think it's a great question. I mean, I think the first thing is we certainly want to be well prepared to care for patients that have COVID-19, but we also want to be sure that we can still care for those that are in urgent need of care. And so we've actually, as people will know, we've reduced a lot of service at the hospital, particularly around elective services, but we have maintained some of that critical service that is required, or emergent service, like in the cardiac program, for example. So as we start thinking about where are we caring for patients, we're quite conscious of where are we going to care for COVID patients that have COVID-19, but also how are we going to protect those that do not. And so even at the level of patients and visitors coming into the hospital are wearing a mask, our staff are masked, so that offers them some level of protection. We've reduced the number of visitors generally at the hospital, and we aren't encouraging people to roam around either. If you're coming into the hospital for that much needed care that we must continue, if you're coming for your cancer care, again, if you're coming for your cardiac care or your dialysis care, we've put in measures to be sure that you're safe when you're coming for that care.
All right, let's go back to the phones. Matt is waiting with a question. Matt, hi, what's your question?
Hi, I'm just worrying about their take on the advice that people are being told by experts on multiple news outlets saying that we shouldn't be wearing masks because it doesn't offer any level of protection and that type of thing. And the reason I pose that question is because obviously the hospitals are appealing to the public to bring those things and to donate them because they need them. But the irony there is that if we're being told by experts that they offer no protection at all, then it's kind of, I mean, what motivation does somebody have to bring them to the hospital if there's no protection involved there? You see what I mean? Clearly, they do offer some level of protection. There's no guarantee that it's going to prevent anything from getting into your system. But to say that there's no protection there at all is just ridiculous.
All right, Matt, appreciate the question. Patrick, I'll come to you at Cambridge Memorial for this one.
Yeah, so Matt, it's a great question. I think, and it's really being clear as to what protection that a mask offers. So out in public, your likelihood of getting droplets on your face from somebody else is low. And I think that's where the experts are saying, you don't need a mask if you're walking down the street and you're maintaining that 2-meter distance. No fluid's going to get on your face. In the hospital environment, the likelihood, the mask is one level of protection around fluids. For that, around droplets for that. That's that, and together with a face shield provides added protection for that. So absolutely critical in a hospital environment. I'm no clinical expert, but in terms of the outside environment where you're maintaining social distancing, I think that's the message, that the masks aren't required or aren't needed in that scenario. And I'd rather see those hospital masks out in the community, in that scenario, donated to one of the 3 hospitals in order that we've got the masks for the clinical staff in terms of meeting that droplet precaution for them.
Patrick, if I may, I want to swing it back just to capacity for a moment again here. And there's no doubt in talking to the 3 of you tonight that there's a tremendous amount of communication and collaboration among the 3 hospitals in our system here in the region of Waterloo. And Ron touched on the more than 400 spaces that have been identified and the partners like hoteliers that we might be working with should there be that super surge. What about jurisdictions outside the region of Waterloo. Depending on how this plays out, is it possible to envision a time where patients from Hamilton, Toronto, Barrie end up coming to the region of Waterloo for care?
Yeah, I think every region, Mike, is looking at how they meet the needs. Whether there ends up being some interregional transfer, depending on where the need is and where the capacity is, that's quite possible. I think also as Ron talked about the ability for us to bring on beds, I have to remember at Cambridge, I've got a whole wing that's half empty now because as we know, we opened Wing A, less than 2 months ago with negative pressure rooms in every single program, with single occupants, 80% single occupancy rooms, so the whole negative pressure zone on one of our units. So we've got kind of a top-notch facility. And then you look at our B wing, our existing tower, we've got empty units in there. So we're actually mobilizing, getting beds and putting them in those areas that we were reusing 2 months ago. So that ability, even amongst our 3 hospitals, to mobilize as much what I'll call conventional hospital space as possible is fantastic to be able to serve the needs of the community here.
Okay, let's squeeze in one more listener question before the break. Amy is with us. Amy, what's your question? Hi there.
Hi. I'm wondering how many of the staff have tested positive at your hospital since the pandemic was declared. And then once they do test positive, what's the process to place in place to get them back to work?
All right, Amy, thank you very much for that question. We'll kind of go around the horn on this one, starting with you, Ron, at Grand River Hospital. The number of patients the number of staff that have tested positive and what happens after they do.
Well, I think in the region, the total number has been about 40 staff that have tested positive. And when they do test positive, they are treated the same as others who test positive. They're asked to stay home, self-isolate, and in our situation, our occupational health and safety department is in touch with them, and we help them to come back to work after they have tested negative, and that requires 2 negative tests within a 24-hour period.
So that's 40 healthcare workers region-wide, you're saying, Ron, but how many at Grand River Hospital?
Sorry, Mike, I don't have that number off the top of my head.
Okay. Lee, do we know how many at St. Mary's?
Again, I worry about being current. So I believe as of yesterday, we had 8 that were there. But again, these are numbers that change. And, I think what's really important is that they are all at home recovering and, in self-isolation at home. And we also know that, as Ron said, it's really critical that we ensure that they no longer have symptoms when they do return to work, and that we've tested them as well before they come back.
Okay, and speaking of that testing, I want to get to this question. I'm going to take one more before the break because BSAN wants to know about testing. We talked to the Premier about this earlier today on the show as well. BSAN, hi.
Hi. My question is just about testing in terms of levels. I understand that we're still receiving tests and we don't have necessarily as many as we'd like, but from what I'm looking at, for example, Maclean's has a breakdown of how many tests are done per 100,000 people in the province, and we're the lowest Ontario is, other than the 3 northern provinces. So we're the 8th lowest of all the provinces per capita. And so I'm just wondering, have you heard whether or not Ontario will ramp up our testing numbers? And B, I'm just kind of bringing it back to the region because I know that we're only testing really medical workers or people who are in serious kind of physical distress or, hospital. So are we going to maybe test more? Are we planning on testing more actively, more widely in the region so we can actually get our pulse on community spread?
BSAN, thanks for the question. Patrick, I'll put that one over to you.
Yeah, I think it's a really important point that's been raised around testing the most vulnerable. So whether the vulnerable population or testing healthcare workers, rather, that's been the priority for that. And that is so that we can get healthcare workers back to work for that. So, from my perspective for that, and I can't speak to whether the province will ramp that up or not. I think if people are sick and then they are self-isolating, so whether they're a healthcare worker or not, you're not interacting with people, you're maintaining you're self-isolating. If you're getting very sick, you're connecting with your primary care provider or a hospital for that. So, while we want to have more increased testing, we kind of know what to do with the test results for that. And so people that find out whether or not they're sick or not, for that, do what you do when you're sick. Stay home, get better for that, and seek medical care if you need it. Mike, back to your previous questions, we've had 4 staff test positive, or wish them all well. And like others have said, we do contact tracing. So for 2 of those 4 staff, they weren't at work. They hadn't been at work for 2 to 4 days beforehand. So we don't have to actually contact trace and go back to who did they interact with, whether that's staff or patients. For the other ones, the staff is self-isolated, and any staff that they might have closely interacted with are self-isolating as well for that. And I wish all 4 of ours a speedy recovery, and look forward to having them back at work.
Patrick Gaskin, the president and CEO of Cambridge Memorial Hospital. We are also joined on this special COVID-19 town hall by Ron Gagnon, the president and CEO at Grand River Hospital, and Lee Fairclough, who's the president of St. Mary's General Hospital. A final break and back with more on this special edition of the Mike Farwell Show. This is 570 News and Rogers TV.
It's a give and take. Mike gives you a chance to call, and we get to hear your take. Call 519-570-2545. More of the Mike Farwell Show after this. Of the Mike Farwell Show. All you need to know about COVID-19 on 570 News. Here's Mike Farwell. And we are joined on this special edition of the program by Patrick Gaskin, who's the president and CEO at Cambridge Memorial Hospital, Ron Gagnon, the president and CEO at Grand River,
and Lee Fairclough, who's the president of St. Mary's Hospital. In our final moments with our hospital executives today, let's go to a question from Lana, who's on the phone. Hi, Lana. What's your question?
Hi. I have something to speak about with the immunity. I'm thinking with the last caller's comments about ramping up the immunity or ramping up the testing. I mean, if more people were tested, it's not just about us who get sick, because most of us recover, right, from it. But say we do recover, we're immune to it, right? So is there not a way that we could be tested and then be able to help us on the front lines, like go into the nursing homes and then into the hospitals? And the saddest part is that these people are dying with no one by their side. So
Lana, I thank you very much I get you, and I want to just give our guests a chance to answer on that because we are running short on time. But Ron, I'll come over to you. I think what Lana is really getting at here is this idea of herd immunity.
Yeah, so the one part of that is testing, and the amount of testing and frequency of testing, and that's something that I think all of us would want to be able to do more. You know, one of the challenges with that, not here, but around the world, is the amount of test kits that are available. And there's some good work happening locally and in the province to look at alternatives to the testing that's being done now. The question was about more on the testing for people who have had it, and then, as you said, herd immunity. And I do know that those tests are being developed in other parts of the world now. They don't exist yet, but I'm sure over time they will, as will a vaccine over time as well.
Right. And Lee, something else Lana touched on was the tragic nature of hearing the stories of someone who unfortunately passed away and wasn't able to have a loved one by their side. What do we need to know about, if we have a partner, another relative, a loved one in the hospital, but with all of the protocols that are in place around COVID-19, are we able to get in and see them?
Yeah, so it's a very good question, and of course a timely question. I do just want to offer the condolences to the two families of the patients that recently passed away at St. Mary's Hospital. We are very restrictive on our visitor policy, as you say, but I can tell you we do give access to families when we know that somebody is potentially nearing the end of their life. That was the case in these situations where people have certainly got access to their loved ones. And so we have a process to enable people to come into the hospital for that, ensures their protection, ensure others' protection, but most importantly, allows them to be with their loved one. The other thing I would just say, I just want to acknowledge, I think it's very hard when you're not able to come in and visit the person that you care about when they're in the hospital. We are trying to support people in other ways, being able to interact virtually. It's nice to have technology like this tonight. That same technology can help families and friends and loved ones to stay connected when somebody's in the hospital.
Patrick, if I can come back to you on this and kind of bring it full circle to where we began our conversations around equipment for patients and protective equipment for staff. But we have heard announcement after announcement from both upper levels of government, quite frankly, about funding to fight COVID-19. And yet we're in a situation here that we're still, I hesitate to use the word scrambling. It's probably the wrong word, but it's what's coming to mind right now, but to make sure we're ready. Why isn't there some sort of centralized funding from the provincial government that we can tap into to meet our needs during this pandemic?
I think the government, and I can't speak to the specifics yet because I don't think we know them, but the government has been very encouraging. So as we've talked about opening up the additional capacity for that, we were given the green lights and the approvals to be able to do that. Most recently, the hospital, even this week, or the government this week directed hospitals to divert some of the money that we have for some of our programs that we know we won't spend because, as Lee talked about, we've ramped down services and things to divert that money in order for the COVID-19 battle. So, I think it's from the support from the government has been strong in terms of us, and as my colleagues have said, from the private sector stepping forward, innovating, looking at opportunities from the public, from across the sectors for that. So I think it's in terms of the ability to access money and resources for that is coming, and more specifics will come in coming days for that. But we're not hesitating or doing what's most important for our community at this time. We're not worrying about the costs associated with that. We are aggressively planning to meet that need for that, and we've been given no cause to pause on that, no cause to say that's not the appropriate thing. We've been encouraged. So whether it's the assessment centers that we've all set up, whether it's additional beds and capacity, whether it's more ventilators that we're purchasing, all of that has been endorsed and supported for that, together with our community and our government partners.
Ron, we've heard an awful lot during this town hall about the level of collaboration between all three hospitals. Can you kind of take us behind the scenes of that, so we know what that looks like from the public's perspective? Are you on calls multiple times a day, the three of you? How does this look from from your perspective as a hospital administrator?
Yeah, it is. It's multiple calls a day. It's multiple texts a day. It's early morning calls, late evening calls. One of the things that we, I think, have all made a commitment to is to move together, as much as possible, is to support each other. How do we act as one, realizing that we are three different organizations, but we're serving one community. And there's no doubt in my mind that my two colleagues wouldn't hesitate to help if our organization needed it, and I know we wouldn't hesitate to help them either.
I think I warned the three of you over email earlier today that this hour would fly by, and at least it has for me. I don't know how it felt on your end, but I know the community, and based on the number of calls we can't get to and emails and tweets, but I know the community appreciates this opportunity to hear straight from you on the COVID-19 pandemic. So to each of you, thank you for the work that you're doing for the community, and thanks very much for making time for us on this program.
Super, Mike. Thanks for having us.
Thank you for having us, and a big shout out to all of the teams in our organizations providing care to patients right now.
Yeah, I'd echo that. They're the ones that really deserve the thanks, and they're doing above and beyond day in, day out.
Absolutely. We're just the administrators.
Ron Gagnon, Patrick Gaskin, and Lee Fairclough. They are the presidents and CEOs of our local hospitals, Cambridge Memorial, Grand River, and St. Mary's General. This has been a special edition of the Mike Farwell Show, the COVID-19 Town Hall. Thanks for being with us on 570 News and Rogers TV.
The news, traffic, and weather you need. Keep it on CKGL-AM, Kitchener, 570 News, broadcasting live from the Boardwalk.
Yeah, thank you. We went with our pajamas for this episode, but big thank you to God Style for being on board for my wardrobe, the jacket that I had at the start of the show. Join our live audience at future filming. You can now get your absolutely free ticket on Buddies in Bad Times Theater website, or write us via facebook.com/join us on the couch. Remember, always be yourself. An original is always so much better than a copy. And love yourself because we love you. Thank you, everyone, for coming. Yes. Bye. All right.
Tonight, two teams that lack consistency on the ice will face off. The Kitchener Rangers are the only Western Conference team to hold a victory in regulation over the Brampton Battalion. The Battalion bring their artillery to the odd on Forbes Kitchener Rangers Hockey on Rogers TV.
And we welcome you inside the Kitchener Memorial Auditorium to the Dom Cardillo Arena for tonight's tilt between the hometown Kitchener Rangers and the visiting Brampton Battalion, making the short trip down the 401 from highway number 10 there in the GTA to join us here in Kitchener tonight. Very glad to have you along as we're just underway here in the first period. And it's new Ranger Matt Tipoff back to the point. Jonathan Jasper's shot is off a leg, and that one goes out of play, bringing a stoppage 1-1 into this first period. And that gives us a chance, Ken Beckett, to take a look at our Popeyes Gym starting goaltenders tonight.
Yes, the starting goalies for both teams. Maverick Parks in net for the Kitchener Rangers. It'll be Jacob Riley for the Battalion. Maverick Parks, somewhat of an Eastern goalie for the Rangers, only faces Eastern Conference teams. That's the case here again tonight against the Battalion.
Of course, Parks, the former Ranger, went to play in that Eastern Conference, and he saw action in both weekend games, although was pulled on Sunday in Ottawa after allowing 3 goals. Brandon Maxwell didn't fare much better, as we see a save made by Riley. The Rangers then came back home and lost not just the game, but the division lead to their Midwest Division rivals, the London Knights, who came in and skated out with a 5-2 victory. It is now a tie atop that Midwest Division. There's Carrick. We keyed on him in our opening tonight. Gets the